Pada perkembangan lain, Kementerian Kesihatan KKM sedang memantau perkembangan kes Chingukunya yang melanda negara jiran iaitu Thailand.
Chikungunya is a viral disease transmitted to humans by infected mosquitoes. It is caused by the Chikungunya virus, CHIKV. Chikungunya is transmitted by the bite of infected mosquitoes, primarily Aedes aegypti and Aedes albopictus, which can also transmit dengue virus. This disease shares some clinical signs with dengue and Zika and can be misdiagnosed in areas where they are common. Severe cases and death from chikungunya are very rare and are almost always related to the other existing health problems. Is it worse than dengue? Chikungunya must be distinguished from dengue. While both disease patients may have diffuse body pain, having chikungunya, the pain is much more intense and localized in the joint and tendons than dengue. There are no specific drugs to cure the disease.
The first case of chikungunya was discovered in the Americas on Caribbean Islands in 2013. Since then, the US, Latin American nations, and Caribbean islands have recorded more than 1.9 million probable cases of illness. It is thought that visitors who were affected brought the illness to the regions. Based on the database, the cluster of patients with clinical diagnosis of chikungunya from January 2006 and December 2009 referred to chikungunya, and 54.1% of them were deemed to be clinical cases of chikungunya by an epidemiological relationship. There were 3 separate outbreaks of chikungunya in Malaysia according to epidemic curves that were constructed using the date of sickness onset for all indicated cluster of patients. Within the state of Perak, there were 2 minor outbreaks in 2006. The outbreaks that caused the cluster of cases in 2008 and 2009 originated in Johor State and afterward to different regions of Malaysia.
Chikungunya fever is caused by the Chikungunya virus. The virus transmitted by bites from female infected mosquito. The 2 species of mosquito involved are Aedes albopictus and Aedes aegypti, which predominantly bite during the day, though there may be peaks of activity in the early morning and late afternoon. Both species are mostly found biting outdoor, but Aedes aegypti will also readily feed indoor. Outbreaks of infection are common and often occur after the rainy season when mosquito breed more actively. After being bitten by an infected mosquito, the onset of illness occurs usually between 3 to 7 days. The virus is transmitted rarely from mother to newborn around the time of birth. In theory, the virus could be spread through a blood transfusion, although there are no known reports of this happening. Risk factor hosts with the heart disease, respiratory disease, hypertension, and a few more.
So, most people infected with Chingukunya virus will develop some symptoms. So usually the symptom will begin 3 to 7 days after infected by mosquito that bites you. So the most common symptoms are fever and joint pain. Other symptoms may include headache, muscle pain, joint swelling, or rash. So death from chikungunya is actually rare. So most patients will feel better within a week. However, joint pain can be severe and disabling and may persist for months. Basically, once a person has been infected, he or she is likely to be protected from future infections. So I will tell you about how to avoid getting infected. So first of all, to protect yourselves and your family from mosquito bites, you can use insect repellent. For babies and children, I will give you some tips on that. So you can dress your child in clothing that covers their arms and legs. Other than that, you can use cover strollers and baby carriers with mosquito netting so that the mosquito can get near your child and your babies. but you need to take caution because when using insect repellent on your child, always follow label instruction. So the insect repellent will not causes any harm on your child. And then the second, the tips for everyone, always follow the product label instructions. When you reapply insect repellent as directed, do not spray repellent on the skin under clothing. And then if you are also using sunscreen, apply sunscreen first and insect repellent second. Other than that, you also can wear long sleeve shirts and long pants. You can try to use treat clothing and gear. Use 0.5% permethrin to treat clothing and gear such as socks and cans, or buy permethrin treated clothing and gear. Permethrin is an insecticide that kills or repels mosquitoes. Permethrin treated clothing provide protection after multiple washing, and do not use permethrin product directly on skin. Third, you can take steps to control mosquito indoors and outdoors too. So first, use screen on windows and doors. Prepare holes in screens to keep the mosquito outdoors. Use air conditioning if available. So stop mosquito from laying eggs in or near water for once a week. Empty and scrub turnover, cover or throw out items that water such as tires, buckets, toys, pools, book bath, and flower pots.